Crapo, thank you. And thank you to the panelists. This has been a very, very informative conversation. And let me echo and agree with my colleagues. I think making telehealth permanent is so important for the reasons that we are discussing today. But I also recognize and really appreciate the challenges that we still need to understand the data. We need to capture the accurate data, the diversity in the data. We need to make sure we put up guardrails to still study it. But for the many reasons we talked about, I think it is so important. I've seen the benefits in Nevada alone. But here's one thing, and we've talked about this already this morning, is audio only diagnostic information. I absolutely have concerns that we are not allowing the diagnostic information for audio only to occur. This is information that I've been talking to the CMS about. And so because I think it is so important we address this, and clearly my colleagues feel the same way after listening to the conversation this morning, Senator Tim Scott and I introduced a bill, the Ensuring Parity in Medicare Advantage for Audio-Only Telehealth Act. It would really require CMS to include diagnosis obtained via audio-only telehealth visits in a Medicare Advantage risk adjustment program. And it is so important for the very reasons that you talked about. So I want to get that out there. But let me also, Dr. Davis, let me ask you this. In your experience, are patients with high deductible health plans more or less likely to seek regular treatment?
In a pre-public health emergency, I certainly saw patients who were hesitant to come in because of the high deductible health plans and just not being able to afford it. The AAFP supported the temporarily waiving the deductible for telehealth visits because the investment was necessary for providers to really be able to make that investment in telehealth. We are concerned, though, with the permanent waiver of that and the possibility of creating a two-tiered system where low-income enrollees are only able to afford virtual care. And so we recommend that the committee pass legislation to allow high-deductible healthcare plans to waive the deductible for primary care and mental health services, both in-person and telehealth, to promote timely access to high-value care and preserve patients' freedom to choose the most appropriate modality of care.
Yeah, I couldn't agree more, and I thank you for that. And so let me jump to Ms. Farb. There was conversation about identifying high quality of telehealth services, and I know you were asked whether GAO has what were the metrics they were looking at, and you said that GAO hadn't defined yet the metrics for identifying the quality of telehealth services. Can you give me a timeline? Is this something that is a priority now for GAO, and is this something you will be further looking into, or GAO will, in identifying those metrics?
Yes, Senator. So as far as identifying and creating the metrics, that's a role that GAO does not play. We rely on the institutions that are sort of responsible and contracted with HHS, such as the National Quality Forum, to develop consensus-based quality metrics. And as I mentioned earlier, both the NCQA, another quality convening organization, and NQF have been working this past year to sort of adapt some of the metrics and frameworks that they use to incorporate telehealth, the concept of telehealth, and focusing it on things that are clinically meaningful for patients and providers to measure quality. So that's sort of what we're waiting on, is to see what these other institutions are going to do in terms of how they're going to define quality. There are ways to compare particular endpoints and outcomes that you could compare telehealth to in-person care, but that's still a ways away for us in terms of our work that we're doing right now.
Well, thank you. And so then let me jump to Dr. DeSherry, because I think it is important. When in your testimony, you really talked about that acute hospital at-home waivers, and particularly the front-end costs of getting things started, whether it's telehealth, acute hospital at-home waivers, whatever's needed, that the hospitals were not making some of these investments long-term because they weren't sure if the waivers will become permanent. And I guess my question to you is, what is it that you need from us at a federal level, or you would think that the hospitals need to really be thinking long term, that we want to move in this direction, short of passing legislation?
Yeah, well, the hospital at home waiver came about last November. And obviously, we don't know exactly when the public health emergency is going to end, but it's tied to the public health emergency. Right now, that date is July. And so making an investment now for a program that might end in July, that's a big decision for a hospital. Making the waiver permanent for another year or another 2 years, or extending the waiver while things are being analyzed, I think that would be one way that would entice the hospitals to apply for it.
Thank you. Thank you again. Thank you to the panel members.
Thank you, Senator Crapo, for